Today, Dr. Cruz is going to tell us all about the Empower Braces system and why it's his number one choice for his patients. Dr. Cruz, can you tell us how Empower braces are different than traditional braces?
Yeah, sure. Generally speaking, a lot of the aspects of the brace are the same, but there's kind of one critical difference. That's what makes it so special. So, if you were to look at a cross section of a brace, kind of magnified, there's a slot, and so the wire that actually moves the teeth is what goes into that slot. And so, back in the old days, what used to be done is that you'd use these colored rubber bands to hold the wire into the brace. And those colored rubber bands would do a good job of holding the wire in, but they would dramatically increase the friction that it would take to be able to move teeth. You'd hear these stories about patients talking about, gosh, when I'd have my braces tightened, it was extremely painful. So with these Empower braces, instead of having to use these colored rubber bands to hold the wire in, it actually has a little door on it. And so you're able to place the wire into the slot and then close the door. And so now that wire is being held in, obviously with that door being closed. And it takes much, much less friction for the wire to be able to slide within that slot now, because you don't have this rubber band that's really pushing up against the wire in the brace. And so that is by far been one of the biggest changes to kind of the design of braces are these braces that have doors, or otherwise known as self-ligating braces, like Empower.
What would you say the main benefit is to the patient? Is it less pain? What is?
Yeah, so there's probably four, and depending on which patient you ask, they might prioritize them differently. But the less friction aspect of it translates into moving teeth more quickly, which patients love that. Nobody wants to be in braces for 3 or 4 years, which is how it used to be when I was a kid. And as a result of the less friction, it's also much more comfortable. So now we don't have to put in these really heavy, stiff wires to overcome that friction to be able to move teeth. Now you can put these really light, flexible wires in, and they're still able to move the teeth in a much more comfortable way. So you don't have that, extreme soreness that used to be associated with braces. And then, some other aspects that are really nice because people have busy schedules is you don't have to have as frequent visits. Instead of seeing patients every month and a half to 2 months, now we're able to see patients closer to every 3 months, which has been really nice.
So, how does a self-ligating feature reduce the treatment times? How does that work?
The key to that is that if you can use a really light, flexible wire, if you imagine somebody that has lots of crowding with their teeth are overlapping, you can now
Yes.
use this light wire to fully engage the wire into the slot of each tooth as you go around. And so now you can imagine having this wire connected to all the braces and fully engaged with less friction. It allows that wire to move and express itself greater distances. And that's the key. You've got this wire that can now take 10, 12, 14 weeks to be able to move the teeth efficiently and straighten them out.
How much shorter would you say, in your experience, are the treatment times?
Yeah, that's a good question. It took me a few years to be able to quantify that. And so I found myself kind of in the early days of my career having a lot of our patients undergo orthodontic treatment, and it would take 2 years. 2 years was kind of the gold standard. And then I started noticing that I was actually finishing treatment ahead of schedule, and it wound up being about 4 to 6 months sooner. And so, on a percentage basis, it's probably 20 to 25% faster.
Wow.
Yeah.
How would you describe the aesthetic advantages to a patient?
That's a good question. For the younger children, the colors are still fashionable. So, some of the kids still want the colors. And so what we've decided to do is we still do have those color elastics, but we're
Hmm.
very selective as to where we put them. So generally speaking, we usually just put them on the upper four front teeth so that they've got the color, they've got the style that they want, but it's not negatively impacting the friction benefit that we talked about. Um, for our older patients, or patients that don't, care about the colors, the braces themselves are smaller, which is nice. And so, they're more comfortable as far as how they feel on the lip. But the fact that they're smaller, nobody wants big, huge braces. And you probably remember, you see it in the movies now, these older movies from the 80s and 90s where somebody would smile and they'd have these massive braces on their teeth. The braces for self-ligating braces like Empower are much, much smaller. So aesthetically, it's nice. And then when you think about the Empower brackets, they have a clear version. And the nice thing about that is the clear brackets that Empower makes are made of ceramic. There was a time where these clear brackets were made of composite, and that composite would stain over time. And now you've got braces that basically look yellow. And with Empower brackets, that ceramic doesn't stain at all. So they stay nice and clear the entire duration of treatment.
How does it help with oral hygiene?
That is probably one of the things that I'm most excited about. I know patients are more excited about it, being more comfortable and treatments going faster. That's all good and fine. Those elastic rubber bands that would go around the brace and hold the wire in, it creates little crevices that food and plaque can get trapped under. And even with good skills as far as brushing, it's a challenge. It's really hard to keep it clean. Those rubber bands, as stylish as they look, they're a plaque trap. And so without having to have those rubber bands holding the wire in, it's so much easier to be able to keep the teeth clean. That's one of the things that I'm really excited about. The last thing you want is to take braces off the teeth at the end of treatment. The teeth are straight, the smile is beautiful, but you've got these white spots as a result of demineralization because plaque's been touching the teeth over a long period of time.
Are there any particular orthodontic issues that Empower is really good at treating versus other systems?
There are, and it's what I would describe as severe crowding. Every once in a while you'll have patients that come in and the teeth are dramatically overlapping with each other. It is amazing what you can see in the first 3 or 4 months of treatment. You get the braces in the right spot. You start with a really light wire, so it's relatively comfortable, and you just let that wire provide constant light force on the teeth. And that's probably worth talking about for a second or two. The old philosophy was more is better, right? I feel like we as people kind of have that philosophy in general. And so the mentality in orthodontics was the more power or the more force that you use, the better it's going to be. What we started to realize is that teeth will actually move more quickly if you provide a light, constant force, as opposed to kind of a heavy force for a short period of time and then re-up it again, heavy, short period force.
Interesting. Yeah.
So with severe crowding, it is amazing how these Empower brackets can, what I would describe as unravel that crowding. The same is also true for really significant spacing, right? You can imagine that if you have less friction of the wire sliding through the brace, you're able to actually close that space more quickly and more efficiently.
What about the comfort level? You've talked about it a bit. Is there anything else you'd like to add? Why is it more comfortable?
It's sort of a twofold aspect, right? And I sort of touched on both, but one is that it's more comfortable because the braces are smaller. And so it's not irritating the lips as much and the cheeks. And then it's more comfortable because we're not having to use these really heavy forced wires. So it's kind of two aspects as to why it's more comfortable.
How often would you say patients need to visit your orthodontist when they're using Empower braces?
The short answer is it's now every 10 to 12 weeks, but it's not just because of the Empower brackets. I know that you and I had done a podcast a couple of months ago about dental monitoring.
Yeah.
And so when you marry these Empower brackets with something like in dental monitoring, which, just kind of a brief recap, the dental monitoring is a small device that you can attach to your phone. And so you're able to scan your teeth once a week, and I'm able to see how you're tracking with treatment, even though you don't have to necessarily come into the office. So I can monitor you remotely. And so now we're able to put these light wires in that have lots of activation built into them over a long period of time. And I'm able to monitor that every single week. And so when you marry those two together, we're now able to see patients every 3 months. And most orthodontic offices are seeing their patients every 6, maybe 8 weeks. And we're able to actually stretch that out probably another 50%.
Dr. Cruz, are Empower braces for both children and adults?
Yep, absolutely. With our kids, oftentimes they'll choose the metal version of the Empower brackets simply because they like the way it looks. They like to be able to change colors at each appointment, kind of have fun with it. But Empower also makes a clear ceramic version, which is excellent, by the way. And the reason I say that is that sometimes clear brackets can be made of a composite, which causes them to stain or discolor and turn yellow over time. Whereas the ceramic stays nice and clear throughout the entire treatment. And most of our adult patients end up going with the clear. They want to be a little bit more discreet.
What's the cost of Empower braces versus other systems?
Yeah, that's a great question. It's definitely worth kind of talking about that. When you think about the cost of traditional brackets, Empower brackets are probably 2 to 3 times more expensive than traditional brackets. But for me, I saw the value in these Empower brackets and being able to treat patients so that they're more comfortable, that we're able to actually move the teeth more quickly in a healthy way. It's easier to keep the brackets clean themselves. So I didn't want the extra cost of those brackets to be an impediment to patients choosing them. So we absorbed the cost of the brackets. We didn't increase our fees, even though all of our patients get the Empower brackets.
What kind of maintenance is required for Empower braces from the patients?
Yeah, pretty similar to the maintenance that's required for traditional brackets. You could argue that it's a little bit easier. The brackets themselves have sort of curved edges and they're not quite so square and sharp, which means that plaque and food are less likely to stick to them. They're smaller, which makes it easier to keep clean. And so, obviously you still have to brush and floss, but it's definitely easier than it would be compared to the larger traditional brackets that people are used to.
Could you explain the philosophy behind the Empower braces system and how it affects patient care?
Yeah. Yeah, the philosophy is to try and reduce friction. That is kind of the biggest kind of notion within that philosophy. And so when you think about how wires used to be attached to braces, you'd have to use these elastic ties on each brace to hold the wire in. And as you add those ties to all of the teeth, it increases the friction. And so the power or force that you need to then put on that brace to move the tooth increases. And so with something like an Empower bracket, you simply close the door and it holds the wire in, but it doesn't increase the friction. So now you don't need to push as hard on the tooth to be able to move it. And then, another really cool feature about the Empower brackets is that the door itself is what's described as active versus passive. In the past,
Yeah.
I'd used passive self-ligating brackets. The way I think about that, it's almost like a garage door that opens and closes straight up and down. Whereas with the Empower brackets, the door actually has a little bit of lean and it pushes in towards the wire. So as the wire gets bigger and bigger when you come in for adjustments, once that wire gets to a certain size, the door will actually start to make contact with the wire and help push it into the slot of the bracket, which then
Mm.
expresses the prescription that's built into the braces and helps with really that fine detail that you're looking for to finish a case and get that best result. So the active aspect of the door on the Empower bracket is also a key feature within the philosophy.
How do you determine if a patient is a good candidate for Empower braces?
It's a good question. There was a time where we would offer, Empower brackets for most of our patients, but there would be situations like for youngsters where sometimes we have to put brackets on primary teeth and we know they're going to fall off. So we're just going to put traditional brackets on those. And it's actually gotten to a point where we actually put Empower brackets on every single patient and every single tooth. It's also quite a bit more efficient for us as a staff to be able to use these brackets. So the idea of being able to put these elastic ties over each and every brace can take time and it's uncomfortable for the patient, as opposed to being able to slide the wire in and then close the doors. And you can it's a little click to close the doors all the way around. And so now we actually use Empower brackets for every single patient on every single tooth.
Do you have any success stories of a patient that was using the system that you want to talk about?
Quite, yeah. The biggest success stories tend to come from patients that have severe crowding. It works wonderfully for all patients, but with mild and moderate crowding, you definitely see the benefits. But for patients that have severe crowding, it is amazing the movement that you can see within the first 2 or 3 months of treatment. we sort of describe it as unraveling, where teeth are literally stacked on top of each other, and you need to sort of
Yes.
unravel them and start to straighten them out. And you can
Wow.
use a really light wire that's more comfortable to be able to do that. And I'm always, I know I'm a tooth nerd, but it's always exciting to be able to see how much movement you can get in just a few months. And I compare that to what it used to be like with traditional brackets, and it's a night and day difference. The same also applies for patients that have lots of spacing, and so oftentimes there's that space that you'll see patients have right between their two upper front teeth, and to be able to close that efficiently and quickly with Empower brackets, it makes all of our patients happy. They've had this space for their entire life, and a matter of months we can get it closed up for them.
What advice would you give someone who's considering using braces or getting braces to improve their smile?
Yeah, I would definitely encourage you to do your research on the difference between kind of traditional brackets, which I would say, and this is my estimate, 70 to 80% of orthodontic offices are still using traditional brackets. Probably, I'm guessing, because of cost. But it's just not, in my opinion, in the best interest of the patient. And so I would just make sure that you take the time to ask that question of, hey, what type of braces do you use? Because I think a lot of people out there would just assume that all offices use either the best braces or all use the same braces. All braces are the same, right? That's probably what I would think. And it's just not the case.
Dr. Cruz, thanks for being on the show again. Got to learn all about Empower braces and look forward to seeing you again.
Yeah, my pleasure.